Hey, hey. Happy Wednesday. How's everybody out there doing today? You know who I am, and if you don't, I am Monique, the Community Health Coordinator here at Whitman-Walker Health, pronouns she, her, hers. And I am back with another Wednesday Live. So let me get into my spiel while folks are joining in. Whitman-Walker Health's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI health practices, access to care, social determinant of health, and general public health interventions. The next series of outreach sessions, will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. Great. No matter how many times I read that every week, I still have to read it. All right. So, March is Women's History Month. And for the last 2 Wednesdays, I have been doing facts about Women's History Month in general, or just great women that we know, some that we may not know. Last week, it was in commemoration of International Women's Day. I did a feature on women who are not necessarily from the United States. They're international or have an international background. But today we are going to focus on women's health, specifically testing. So all the testing that a woman might need within her lifespan. So I know that we as a people in general, and then specifically the Black and African American community, we have a love-hate relationship with healthcare providers and doctors, but it's important as a woman to get to know your body and overall health and make sure you get that checked regularly. Now, when I say regularly, I mean the annual physical that you're supposed to have, but also getting things checked in between, like HIV, STI, which should be done every 6 months and every 3 months, respectively. And that we should also take into account mental health, which plays a big role in our in achieving overall health and wellness, as well as spiritual health, as that pertains to you as a person, just to make sure that every aspect of your person is covered and taken care of. So for this live, I'm going to talk about some of the testing that we should keep in mind when we're taking care of ourselves as we age, right? So 2 things tied at number 1 for me, or that I wanted to speak about first, which are Pap smears and HPV testing, okay? So between the ages of 20 to 30, you should do a Pap smear and HPV screening to look for pre or early cervical cancer and HPV. Women ages 30 to 65 who have a normal Pap smear, and a negative HPV test need to be only screened every 5 years, right? So you go get your Pap smear. They're like, oh, it's normal. Before, you used to have to get it every year. Then it went to every 2 years. Now it's every 5 years. So once your Pap smear and your HPV tests come back normal, you don't have to get screened again for it for 5 years, but you also need to be keeping up in your mind, clearly, it's going to be in your medical record as well. But if you happen to change doctors in between that time, just make sure that you're keeping up with, I got this done last year or 2 years ago, so it's either 3 or 4 years before I get it done again. STD screenings. So many people who, as we know, have STDs used interchangeably, are usually asymptomatic, which means they have no symptoms, so you can pass it to your partner, or if you're pregnant, to your unborn child without knowing. So all women who are sexually active from the ages of 13 to 65 should be getting screened regularly for STIs. Here at Whitman-Walker Health, we recommend that you screen every 3 months because the most common symptom is to not have any symptoms at all. So you don't want to go too long not knowing, and then also switching partners and not knowing, and then you just happen to be like, oh, let me stop in here and get an STI test, and you come back positive, and you don't know when, you don't know with who. You could have possibly given it to some, like your new partner, if you have a new partner now. So every 3 months is what we recommend here at Whitman-Walker Health. It is especially important for women under age 25. And those who have new or multiple partners, specifically for under age 25, because between 13 and like 25, your body is literally still developing. So it's actually easier for you to contract any of these developing during that time frame. So that's why it's very, very important for you, anyone under age 25, to be tested regularly. Sorry about that. Little connectivity issues. Third test, pregnancy test. So, pregnancy test, you know what? I was going to say it shouldn't be an annual thing, but that depends on you. You know your activity. You know how you're living your lifestyle. So you get a pregnancy test when you need to get a pregnancy test. However, if you suspect that you might be pregnant, getting tested early puts you on the path for good prenatal care. You know, making sure that you get to your OB or your midwife early on in your pregnancy. Make sure that you start taking your prenatal vitamins early on in your pregnancy. Making sure that you start eating well. If your eating habits are a little off, make sure that you avoid drugs and alcohol if those are your vices that you like to partake in prior to pregnancy. But also, knowing early can also help you make better informed decisions that may not necessarily include carrying to term. So, and I think we all know what that means. If you don't decide that you want to carry the pregnancy to term, knowing early gives you a lot more to think about, but it also gives you other avenues of decisions to make. And the earlier, the better. Right. Next test that women should get are mammograms. Now, folks think, or traditionally, women don't usually get mammograms until they're like 40, right? However, doctors recommend that if breast cancer is something that runs in your family, then you should be getting screened earlier, like 35. Some places will actually allow you to screen a little bit earlier than 35 too, like maybe 33, 34. But generally, when you turn 40, you should start getting screened annually for breast cancer. Also, you can manually in the shower do a self breast exam and feel for any lumps, any irregularities, anything that when you did the self exam last week that you're now feeling this week. So that you know, so you can go to the doctor and be like, hey, did a breast exam last week, didn't feel something, but did one 2 days ago, and I feel a lump, something feels different. Can you check it out for me, okay? You always have to be in tune with your body so you know what's working for you. Next thing, which when I was doing research, I found out that we should be doing, and I am actually going to start doing that as of today, is a skin check. So, of course, the body ages. As the body ages, your skin changes. And at age 18, which I thought was pretty young, like I think the skin is still popping at age 18, but apparently at age 18, you should be checking your skin monthly for suspicious moles, changes in color, especially if you're fair skin or exposed to the sun constantly. Full body yearly skin exams by your dermatologist should begin at age 40 as well. Also, I think I want to put that out there. So everyone, right? We're exposed to the sun all the time, not just in summer, like year round. Even in the winter time, we may not get a lot of sunshine, but we're exposed to the sun year round. Everyone, black, white, purple, multicolored, whatever you are, however you define yourself, you should be using sunscreen all year round. Okay, we get exposed to those sun rays all year round. If you're going out, even if you're not going outside, you have windows in your house and the blinds are open, you need to be putting on sunscreen. Probably particularly on your face and your hands, because those are the parts of skin that are exposed the most. But you should be wearing sunscreen. Sunscreen is for everybody. I promise you. Not only will you be doing your part in avoiding getting any type of skin cancers, but sunscreen also helps to keep the youthful appearance in your skin. So, sunscreen. Next test, bone density test. So the denser your bones, the less likely they are to break, right? And if you have like a thin build, like skin on the skinnier side of the scale, or have like other serious risk factors, like maybe like brittle bone disease, things like that, begin getting tested at age 50. Now, 50 sounds old, right? But 50 is actually like the new 25 for real. So make sure that you start getting tested for bone density. Otherwise, any general guidelines says to start after 65. But also keep in mind that some medications that you may take way before you're 50, way before you're 65, can also have a side effect that is bone density loss. So you may want to get that checked out earlier than the recommended age of 50. I know like birth control, like Depo, causes bone density loss. And some young ladies start taking Depo at 13. So you might want to get tested for, do a bone density test way before 50 if you happen to be taking Depo at 13 or 15 or 18, whatever. Okay. Next thing, hearing test. Just like with skin, as you age, everything starts to deteriorate, right? Everything starts to deteriorate. So impaired hearing affects your mental processes, and it can hurt your quality of life, like overall quality of life. So getting your ears tested every 10 years until the age of 50, and then every year after is what's recommended. Also a note, I know that we like to, so we have headphones, right? But I know that we like to, even me, I stopped a while ago, but like stick Q-tips in our ears. After we get out the shower, we stick Q-tips in our ears, clean out our ears. But that actually should not actually be doing that. Because Q-tips, what it actually does is push the earwax in more. I mean, we get some out, right? When we see it, we get it out. And we can visually see that, I got some, wax out, which is why we keep doing it, right? But it actually pushes the majority of the wax into your ear. And every time you do it, you're just impacting wax on top of wax on top of wax until it actually gets hard for you to hear. And you're like, dang, I can't hear. You got to go to the emergency room or urgent care, and they have to like drain your ear out. And then you see this big clump of wax come out after it gets dislodged. Yeah, that's from sticking the Q-tip all in there, trying to get it out. So what you can do to avoid that is like every year or every 2 years, go to an ENT practitioner. ENT is ear, neck, and throat. Most insurances, if not all insurances, cover ENTs. And yep, they can just go in there, clean it out for you, and you'll be on your merry way. You can hear again. Next test, eye exam. Same thing with the last 2 exams. As you get older, things start to diminish. So the recommended guidelines for adult is just a baseline eye exam at age 18. Of course, you get eye exams before that, right? Like kids get eye exams when they go to their doctor's appointments. However, like before an actual comprehensive where they're testing everything, checking if you have glaucoma and things like that, like a baseline eye exam You do at age 18 and then every 2 years until you turn 60, unless there's a problem like I said, with such as like diabetes or glaucoma or anything, especially if those things run in your family. And glaucoma and diabetes in the eye actually are very, very prevalent in the Black and African American community. So make sure you're going to get your eyes checked so that you know and so that you can see any early signs. This also goes for folks who have had corrective eye surgery like LASIK or PRK surgery. So I had PRK surgery, which is almost like LASIK, just a little bit more invasive than LASIK. LASIK is a little bit quicker, but the process is similarly the same. I corrected my visions, right? Got my corneas reshaped by a laser. So now I have great vision. Last time I went, they said it was 20/20. However, again, with age, things diminish, right? So you still may need like reading glasses at a later age, or you may need glasses to drive at night when there are too many lights and things get blurry, things of that nature. So you still, even if you've had corrective eye surgery, you still should be getting your eyes checked every 2 years to make sure that any of those other visual problems aren't affecting you. Next one, really, really big, blood pressure screening. High blood pressure is associated with heart disease, diabetes, and an increased potential for a heart attack and stroke. So, and again, just like with the eye exam, and people of color having a higher rate of having like glaucoma, diabetes of the eye. Same thing with same thing with high blood pressure, right? So it's a significant problem within the African American and Black community. So make sure that you're keeping up with it. Most doctors begin this screening actually with children as young as 2 if they are obese, and then they can continue to check annually. So you just want to make sure that you're paying attention because high blood pressure is like legit no joke. Also with the next test, which is cholesterol. So the American Heart Association recommends a baseline test at age 10. Yes, age 10. And then repeating the test every 4 to 6 years for people at average risk of high cholesterol, which is also another thing that is that has high rates in the Black and African American community. So we want to make sure that we are paying attention to these tests, making sure that we know when to get them. So I can actually run it back from the top. Pap Smears and Hpv, that should be done every 5 years. If your last test in Pap smear were normal. STD testing happens every 3 months is what we recommend. Every 3 months. For HIV, we recommend every 6 months, okay? Pregnancy test. We recommend that whenever you need to do it. Whenever you if you suspect that you are pregnant, that's when you do a pregnancy test. Mammogram, it's recommended to start at age 40. However, like I said earlier, some doctors will let you do it at between age 33 and age 35, depending on if breast cancer is something that like has been happening in your family. Skin check. Make sure that you are using your SPF every day. Doesn't matter if it's wintertime. Make sure you use your SPF. Make sure that you notice changes on your skin. If you have a mole that wasn't there before, skin is changed, like you're getting spots, skin is changing color. Make sure that you notice all of that. Bone density test, especially if you're taking any type of medication where bone density loss is a side effect. Make sure that you're taking care of that. Hearing test, lay off the Q-tips, please. If you feel like you can't hear, your hearing has diminished, you can go to urgent care or emergency room and they can check for you. If you have wax buildup, they can usually, I think it's usually water to like moisten it up because the wax gets hard in there, which which dulls the sound, which makes you can't hear. And once it gets soft, it'll like pluck out and you'll see it come out. Stop with the Q-tips. Stop with the Q-tips. If you feel so, you can take like a wet washcloth and like wipe out the outer, but stop with the Q-tips. Eye exam, making sure that you're checking, going to get checked baseline at age 18, and then every 2 years after that. Usually if you have glasses, I think it's like every one. I used to wear glasses, but now that I have LASIK, don't have to go back as often, so I go every 2 years. But if you have glasses, maybe I think it was every year, so you can check if your prescription has changed. Blood pressure screening, need to know because it's linked to heart disease, diabetes, and heart attacks. So be paying attention to your blood pressure. Cholesterol test, same thing. Make sure you get that every 4 to 6 years if it's normal, okay? Baseline test is actually at age 10. Now, as I wrap up, just want to let you know that the root of all of these tests, now while this was supposed to be for women's health, actually all of these tests, with the exception, of course, of the Pap smear and mammogram and pregnancy test, can be applied to anyone. Everyone should be checking on their health. But at the root of all these exams, we also have to make sure that we're doing our part in maintaining our bodies in between all the testing and in between your annual physical, right? Just like how, like, if you have a housekeeper, the housekeeper comes and does a deep clean once a month, and the other 3 weeks of the month, you're just doing, your light dusting to make sure that you maintain the overall cleanliness of your home until the housekeeper comes again at the beginning of the next month or at the end of the next month, however you have it scheduled, and does another deep cleaning. Same thing with your body, right? So you go to the doctor, get everything checked out from top to bottom, or from the rooter to the tutor, like my mom usually says. And in between your annual physical and testing, you do the things that you need to do to maintain your body. So that's eating a well-balanced diet. That's your fruits, your vegetables, your healthy proteins and starches. Making sure you have time to relax your mind and your heart, whether that's meditation, whether that's going for a walk, whether that's just like giving yourself 5 minutes to calm down. iPhone and Android have bomb apps to help you achieve that. Let's see. Oh, also, I didn't mention going to the dentist. So I think people underestimate how much oral health plays with your overall health. But like, if if a tooth in your mouth is infected, like sometimes you can't eat. Sometimes you can't even open your mouth wide enough to even say hello. I actually had that happen to me. I had a tooth that cracked, so it had a little hole in it, and I kept going about my business because it wasn't really bothering me until food got caught in it, and it got infected. And when I tell you I couldn't even open my mouth to eat, I was in so much pain. It caused me headaches. It caused my inner ear to hurt. And that's just from one tooth. So I had to get antibiotics, let it clear up the infection, and then have that tooth removed. Because at that point, by that time, I needed a root canal. So I had to go get a root canal on that tooth. So please also pay attention to your oral health. Physical exercise is a big thing. We have to keep our hearts pumping, keep our blood flowing through our vessels and our arteries. If you walk at least 20 minutes a day, you'll start to notice health benefits, such as heart health improvement, slimming down if you're trying to lose weight, having a clear mind. And honestly, it puts you in a better mood, right? You get fresh air in and out of your lungs. It's getting warm outside. I know it's a little bit harder in the wintertime to walk 20 minutes because nobody is walking in the cold anywhere. But if you have a gym, you can walk your gym. If you live in a building with stairs, you can walk up and down the stairs for maybe 25 minutes so you can get your heart pumping and your blood flowing. Just move, as long as you move your body consistently, like your body will do what it needs to do for you. Okay? So that is all I have to share for today on testing and women's health, and technically everyone's health, because everyone should be paying attention to these things. Just another update that mask mandates have been, lifted around our area. Started March 1st. We had another mandate that made masks optional for daycares and schools. It actually started today. So, just be careful if you choose to take off your mask. I get it. We've been wearing masks for 2 years now. You're tired. You want to see people's faces. You want to see people's smiles. However, know that if you are in a small, crowded area, maybe you should have one on. It also is allergy season, so people will be coughing and sneezing, runny eyes, scratchy throats. So, just also be mindful of that. But always, 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 if you choose to take your mask off, wash your hands. Hand sanitizer where you have to, but wash your hands. Wash your hands, wash your hands, wash your hands. All right? So that concludes this Wednesday. I will see you guys next Wednesday. Same time, same IG place. Have a great one.